good friend of mine. We were trying to figure out how long we've known each other, but it's more than 20 years, and that's the Honorable Berkeley Goodell is here with his lovely wife Eleanor and some of his family. Berkeley was a four-time congressman from Iowa, and he also, if anybody fish, anybody go fishing? You probably know the name Berkeley. There's Berkeley, everything fishing, right? That's Berkeley. Anyway, he's no longer involved now, but he's a staunch proponent of adult stem cell work, and he's been doing a lot of work through the political process, through his foundation. He and his family, his daughter Jo, also is very heavily involved in that, on trying to get the rules, some of the regulations changed here in the United States so that some of the treatments that are going on around the world can be done here instead of elsewhere. So anyway, I'd like to welcome Mr. Goodell, and I want to thank Holly Huber. Holly is she's a patient, and she's been a patient for a couple of years, and she's probably going to talk later, but she traveled all the way from San Diego to help us out with this conference.
Oh, wow.
She's volunteering, so I really appreciate that. Thank you so much.
Thank you.
And I want to thank Cindy Cunningham, who is our event coordinator. Today is actually her birthday, and she's here work. She'd rather be doing that.
Happy birthday.
And I want to say thank you to Juan Carlos Murillo, who's come up from Costa Rica, and I think he's going to talk a little bit later. Thank you very much for coming. And Dr. Maharaj is here. He's a true pioneer in stem cells. He has his own, he does mostly bone marrow stem cell work here in South Florida. True pioneer, and I really appreciate him coming. And Ray Crawley was mentioned as well. Ray has a hyperbaric center, and he's done some really pioneering work with hyperbarics and stem cells on traumatic brain injury and other things. So thank you guys. Last but not least, we have Sherry Lund and Rob Shimitz. I'm sorry, I can't pronounce his name. But they're from the Celebration Stem Cell Center in Gilbert, Arizona. And they're doing some very interesting work. They have a umbilical cord blood bank, but they're also doing some very exciting research out there. So thank you for coming. So I am going to talk about non-controversial stem cells and the rationale for their clinical use. And I use the word non-controversial because all the sources that we use are really not controversial. There's nobody being harmed in the process of acquiring the raw materials for the stem cells that we use. I'm going to give you a little bit of history of how we got started, where we got started. I'm going to talk a little bit about the types of stem cells. I may repeat some of the things that Dr. Smith said, but I was told not to say Dr. Smith said this for video purposes, so I'll try to avoid that.
Just a small story through a common friend, physician, who had a heart disease. And he had what we call a cardiomyopathy, a really bad heart disease that the outcome was not good. And so he looked at many options, and nothing really that he looked at was going to change the outcome. And so he looked, and he found Neil in Costa Rica. And at that time, they had not treated anybody with heart disease. And he told him, it makes so much sense to treat me. Well, he got treated. He improved dramatically his heart function, so he called it. It's growing a lot. You know, there is significant evidence not only of what we're doing, but other scientific groups. And every day, if you go to medical journals, there's more and more information out there about what adult stem cells are doing. So when people say, well, there's not enough evidence, it's because they're not looking. And so again, in MS, we really have had really good success. There's many types of MS, and I'm not going to go through that now, but in general, they do well. Sometimes you have to repeat it because you can control or can help the immune system so much, and sometimes they require what we call like a booster therapy, and we do that. As you see, we treated over 200 patients, and we're really happy with the success rate, especially once we implemented the FAT to the protocol. And this was described before. the publications of the rationale. And that's really, I can't overemphasize that point, is that we really have proactively, for me, that was another exciting part when I joined the group, is that we're truly concerned about the science of all this. It's not a matter of treating patients and not worrying about if they're improving or not, but really following them up, seeing what can we do to get them better, and doing it in a scientific way. And that's why I feel really proud of what we're doing there, and groups in the U.S. are acknowledging that, and they're trying, and we're working in collaboration with several university programs to do formal studies so we can document things in black and white, which at the end of the day in medicine, that's what we want. In rheumatoid arthritis, again, the